Thank you for joining us for another segment of our myofascial health and self-care series. Today we're going to work a bit through shoulders, upper back, chest, some things to help loosen, address some of that chronic office posture that many of us have. You're going to need a ball and a place to lie on the floor, or preferably a firmer surface, not a couch or a bed. Lying on a yoga mat, a folded up blanket, those are all fine, but preferably find a firm surface to lie on. Grab your 4-inch ball, go ahead and make your way down to the floor. We're going to be lying face up. Knees can be bent or legs can be out straight. Find the position that is most comfortable for you. We're going to be here for a bit. Once you're there on the floor, go ahead and place that ball anywhere in that mid to upper back area, right along the spine. You don't have to avoid the spine here. Anywhere around a bra strap line or right between your shoulder blades are some good reference points. If you need to, support your head with your hands as you roll around a bit on the ball, kind of up and down the spine, a little bit side to side into the ribs, looking for a spot that feels tender, maybe kind of sore or stuck, maybe even hard or hot. Roll around a bit, explore that upper mid part of your back with the ball. When you do find a tender spot, go ahead and slow any movement, any exploration, and start to settle there over the ball. Sink, soften, melt, allow that ball to reach into the tissues. One of those phrases is going to resonate with you. Start to slow your breathing and soften over the ball. Go ahead and let your head start to gently rest back down onto the floor as you lengthen your arms out to your side. Just feel what that's like. You might have to shift a bit to find a spot that's less uncomfortable, that's more comfortable for you here. If you find you're holding your breath, you may need to shift a bit, maybe even take a moment and let some air out of the ball. We want to find that edge of discomfort. Go ahead and close your eyes. Slow your breathing. Start to quieten your mind. Allow yourself to melt over the ball. As you do, you may find your lower back dropping a bit onto the floor. You may find your shoulders softening and starting to drop. There may be areas of the body that are starting to talk, starting to draw your awareness, increase your awareness of them. That's all good. As you continue to soften and settle over the ball here, I would encourage you to lengthen through your arms even a bit more, almost like I have a string attached to your fingertips, gently pulling them away from the body. Don't use a lot of muscular effort here. Just a gentle opening of your palm, perhaps a flattening of the back of your hand onto the floor, the back of your wrist onto the floor. Little bit of lengthening while that ball works through the back and through the ribs and the spine. Gentle exploration. If anything causes you to hold your breath, to clench anywhere in your body, ease back off that stretch. Shift on the ball just a little bit if you need to. With that lengthening through the arms, I want you to go ahead and start to use one or both arms. It doesn't matter. One arm or both arms. Start to slowly slide them along the floor, up toward overhead, and then back down toward your sides, like you're making a snow angel. Slow exploratory movement. Arms gently moving up toward overhead on the floor. Keep them on the floor, and then back down. Finding a next spot that's a little bit tender, a little bit stuck. Now you may find that one arm moves up toward overhead more than the other or less than the other. Your arms don't have to stay at the same angle, at the same height. When your right arm finds a stopping place, let it rest there. Finding a stopping place for your left arm also. Shifting how your spine and ribs are softening over that ball by using your arms to nudge into that next tender or tight area. When you've found a position for both arms that engages with that next area of tightness, go ahead and let your arms soften again into the floor. Lengthen a bit through the fingertips, opening through the palm, slowing the breathing again, softening back over the ball. If you find your mind starting to drift, gently bring your awareness back to your body, in particular to your ribs, your spine, your sternum, your shoulders, feeling what it's like to breathe. Perhaps expanding with a deep inhale into your ribs and noticing the effect of the ball under your back. Never forcing, but be curious. Where might you increase movement and space? Deep, slow breaths in and out, expanding three-dimensionally through your ribs as you do. Inhaling the sternum up toward the ceiling, the ribs out to your sides and down into the floor like a balloon inflating in 3 dimensions. And then exhaling, Simply letting that air leave your lungs without effort, without thought. Feeling a difference as you continue slow, deep breathing, inhaling and exhaling. This may be a good time to again lengthen through your fingertips, opening your palm gently. Perhaps flattening the back of your hand against the floor, the wrist against the floor. Nudging if you'd like. One more time into that snow angel motion. Moving your arms again a bit overhead and then down towards your body. Sliding them along the floor. Finding a position where something feels a bit stuck as you move your arms. Again, they do not have to be at the same height or angle. You might have one arm down by your side and one more overhead. There's no wrong way here. Never force. Never push into injury. Trusting your instinctive, intuitive sense that will let you know what is enough for you. Again, slowing your breathing, softening in your body, checking for any tension in your legs, your hips, your glutes, your low back, your neck, your throat, softening in those areas as you can. Take a few more slow, deep breaths here. I want you to start to slowly move your arms down more towards your side from wherever they are to a comfortable position by your side. Then take a deep breath in and out, and as you do, start to reach your right hand down past your hip and towards your feet, keeping your back and your arm on the floor, moving in a different way over and around that ball. Notice if you start to hold your breath. This doesn't have to be a large motion. By no means do you actually have to touch your feet. That's not possible. But we want to side bend, reaching down toward the feet on the right and opening the ribs on the left. Gentle movement. Now, if anything starts to spasm here, pause, breathe, soften wherever you might be holding in your body. That's not going to help. Allow that spasm to pass. It's the body trying to do something that it doesn't quite have space to do yet. Soften in your shoulders, in your neck, and in your throat. Not a lot of muscular effort here. Just a gentle reaching down toward your right. Keeping your back, your neck, your shoulders, your arms on the floor. Expanding a bit more through the ribs on the left. Deep, slow breaths in and out. Unclenching through your low back, your hips, your glutes, your abdomen. Let this be easy. Finding a movement here that works within what your body will allow. Never forcing. If you're reaching just with your arm, maybe lean your neck just a bit that way also. Again, keeping your back, your shoulders on the floor. We're not lifting off the floor here. Deep, slow breaths in and out. If you're having trouble slowing your breathing, consider backing out of this side bend just a little bit. Imagine the ribs on the left side opening even more as you breathe in and out. Nudging a bit more if you can, if there's space. We're not going to stay here 5 minutes. If this does feel instinctively good and helpful to you, by all means, stay here. Trust what you feel. Trust your instinctive sense of what you need today. But if you're ready, go ahead and start to bring your head, neck, and spine back to center. Shoulders more level and even with each other. Then we're going to go the opposite direction. Again, keeping head, shoulders, back, arms on the floor. Just start to reach your left arm down towards your feet. We're not going to get there, but reach in that direction. The side bend to your left, opening the ribs on the right. You're probably going to notice some differences between how the left side and the right side move and feel. It's information, neither good nor bad, simply information. As you reach your hand down toward the left, breathe into and expand the right ribs. Allow your neck to start to drift toward the left also, keeping the head on the ground. Side bending over the ball, using that as a lever into tight, thick, stuck areas of the back, the spine, and the ribs. Again, if something spasms, pause for a moment and breathe. Slow your breathing and unclench anywhere you might be holding. Allow that to pass through you as the body and tissues change in ways they haven't been able to. You can take out the slack there on the left and reach a bit further, never forcing. Slow, deep breathing here, opening the ribs on the right side. Be curious about what you feel here. Actively engaged with any tight, sore areas in your body. Softening into them, softening over the ball, letting it act as a lever. Again, if you instinctively feel the need to stay here, don't be in a hurry to move. Stay with this opening through the right ribs as long as you would like. When you are ready, go ahead and start to bring your head and neck back toward midline, allowing your shoulders to come level again. Then, however you'd like to, go ahead and get off that ball. You can scooch to the side, you can reach behind you. Go ahead and take that ball out and let your back settle onto the floor. You might feel a variety of things here. Sometimes it feels like there's still a ball there, or there's a hole under the floor behind you. Let your body settle onto the floor. And then start to explore some gentle movement of your spine. Slower, smaller movements, perhaps of reaching down toward the right foot and then the left foot. You may want to bring your right arm across your body, a little bit of a twist. And then the left arm across the body in a little bit of a twist. You may want to shake out or wiggle your feet or legs, your hips, up into your spine and shoulders. A little bit of movement there. Notice what's different. Breathe into and feel for an openness in your chest, along your sternum and the front of your shoulders. Come back and practice this again. Thanks for joining.